I'd like to thank the senator and representative from Arkansas for making the long trip here. I got up around 5:30 this morning and drove from western Pennsylvania to make it over here in time for the press conference this morning, but they had to catch a plane yesterday to come all the way up north, so we really appreciate them taking time out of their schedules. And of course, the sacrifice for them was to get here yesterday, be here today, and then finally get plugged back in, hopefully, into their own schedules tomorrow. So thank you guys for making the trip here to Pennsylvania to share with us the mistake that was made in Arkansas and the path that the governor seems to want to put us on to make an even bigger mistake here in Pennsylvania. And years ago, I had written one of my monthly Metcalfe memos on some legislation that had moved about, and legislation that does move through the Capitol, and how at times politicians try and rename pieces of legislation or rename taxes to give the voters some impression that they're getting something different than what was already proposed. And that's exactly what the governor and his team have done here yesterday, was to propose Medicaid expansion, propose a welfare state expansion, and try and sell it to the voters under a different name. But of course, it's not the governor that came up with that idea. It's being done in Arkansas and other states around the country. But the governor is playing a not-so-good shell game. I started watching some of his press conference a little bit last night before I had to hit the rack to be able to make it down here early this morning. And to be honest, I didn't make it through the whole press conference. It was painful. As he read his prepared remarks, he was painfully making his way through them, and he was not moving the shells fast enough to fool the voters. Because when you propose taking tax dollars from the federal government and spending that on adding people to the welfare rolls in Pennsylvania, whether it's insurance that's being provided by government or insurance that's being provided out of the private sector, it's still being paid for with tax dollars. Whether it's coming out of our federal tax pocket or our state tax pocket, it's still a burden on Pennsylvania's taxpayers. And that's what the governor is proposing. The governor was correct earlier this year when he had stated that with 1 in 6 Pennsylvanians on Medicaid, we cannot afford the current system, much less a new system to where we could see up to 1 in 4 Pennsylvanians being on welfare for their health care in Pennsylvania. So as the governor tries to move these shells in his shell game, and he's put a lot of dressing out there, as the gentleman from Arkansas were talking about some of the other reform measures that are being proposed. He's put some small carrots out there for conservatives across the state and for voters across the state to say, yeah, that makes sense, we should have that type of reform, or we should have that type of reform. But at the end of the day, the majority of what he is proposing in his health care plan that he announced yesterday is to put, as Jennifer had said, more than 500,000, possibly close to 1 million more people into government paid for health care, which is an expansion of the welfare state in Pennsylvania. And the last time I heard from voters, which was as recent as on Facebook about this morning and yesterday, the voters of Pennsylvania aren't buying any type of welfare expansion. The governor can call it whatever he likes. He can try and say it's not Medicaid expansion, but at the end of the day, everybody who's honest with themselves has to admit that this is expanding welfare in Pennsylvania. When you're going to use government tax dollars to buy insurance and force the taxpayers to pay for their neighbors' health care, that is welfare. We can't sustain the current system. We need reforms. But as the gentleman from Arkansas said, we can't have reforms at the end of an arm twisting that ends up getting us in deeper than we were before. The governor is proposing to add more people to welfare in Pennsylvania. I wish he'd be honest with the people of Pennsylvania and just say that. The governor is not going to get away with, at this point in his term, coming out and making this type of proposal and thinking that it's going to save him in next year's elections. The governor is not going to be able to sell this to the electorate. As was said from the gentleman from Arkansas, if this was to be passed in the state legislature, which the governor seems to think he doesn't have to come through the people's elected representatives to make this happen, although looking at his press release yesterday as I read through it this morning, certainly there's components of it that he has to get approval from the legislature. He must get approval on certain aspects of this plan that he announced yesterday from the legislature. So for him to think that he's going to bypass the people's elected representatives and that he's going to do that and fool them, he's mistaken, because the Democratic caucus, the Democrats in both the House and the Senate, if this were to pass, would, just as they did in Arkansas, claim victory for Obama and Obamacare implementation. Because what Corbett is going to do is help to facilitate the advancement of Obamacare in Pennsylvania. Recent polls show that the majority of Americans aren't buying Obamacare any longer. They understand that Obamacare is killing jobs. We're seeing one company after another lay people off or do away with positions or reduce hours based on having to implement Obamacare or the fear of having to implement Obamacare in the near future. So with people losing employment and healthcare costs rising, the people of America, the citizens of the United States of America, understand Obamacare is costing us, it's not helping us. And Tom Corbett must understand that embracing Obamacare in Pennsylvania through an expansion of the welfare state is not going to help Pennsylvania, it's going to hurt Pennsylvania taxpayers.